The envelope slipped under my door like a whispered accusation. Dr. Sophia Lang would keynote the National Orthopedic Symposium on Pioneering Joint Repair, Ethics and Intervention. Saturday, April 20th, 1 p.m. I read at mid-rehab session, my hands trembling on the treadmill as I coaxed my battered knees forward. For weeks post my fifth knee reconstruction, a grueling 10-hour ordeal fixing botched prior fixes. Tough news? My therapist, Jamal, asked. My sister's headlining on surgical ethics. Impressive. Attending? She's an orthopedic star. Thinks all my ops were avoidable. Jamal's brow furrowed. Your own sister, a specialist, calls your surgeries pointless? She says I'm chasing fixes for drama. At 35, I towered over Sophia by 3 years, but she shone brighter. Elite surgeon at a top university hospital, award-winning innovator, media darling. Our folks paraded her achievements endlessly. Me? The ex-corporate attorney sidelined by aggressive osteoarthritis that hit like a freight train, forcing me out of courtrooms where standing became torture. Now, I consulted remotely on regulatory matters between recoveries. Elena just needs willpower, Mom would sigh. Too many pills and knives. Sophia preached, joint pains often mental, overtreated with hasty cuts. What they ignored, my real role. Lead compliance officer for the state's health oversight agency. I vetted doctor misconduct, probed grievances, shaped policy on practitioner accountability. 2 months back, a grievance landed on my desk against Sophia. A client claimed she brushed off intensifying hip pain post-replacement as whining, skipping scans and urging grit. The implant had dislodged entirely, causing nerve damage and mobility loss. Another doc's urgent intervention prevented full immobility, but the patient limped permanently. I flagged the kin tie. Instantly, stepping aside, but I'd glimpsed the dossier. 4 parallel cases, ignored red flags, labeled patients overly sensitive. 2 faced irreversible harm from stalled care. Sophia had no clue about my agency gig, she pegged me for dull admin drudgery. Certainly unaware her credentials hung in review, with a panel date set for Tuesday, April 23rd, mere days after her spotlight moment. Saturday dawned, I squeezed into a suit that draped my post-op frailty, the fresh scar a fiery streak across my right knee. Jamal warned against it, too raw at 4 weeks. But I had to witness. The drive jarred every nerve, the venue buzzed with 400 med pros. Sophia was the draw. I slunk to the rear, parents glowed up front. The MC lauded her, Dr. Sophia Lang, trailblazer in joint tech, 52 publications, 3 patents, youngest recipient of the Ortho Vanguard Prize at 32. She strode up, poised and magnetic. Grateful to discuss ethical surgery. We wield scalpels that alter destinies, discernment is key, operate only when essential, not on whim. Slide 1 flickered. Patient demands for unneeded interventions plague us. They hop docs for the yes man, ignoring risks. I've staked my rep on vetoing the unwarranted, pushing rehab and habits instead. Sure, some rage, dub me cold, but better that than needless scars. My gut nodded. Even kin tests this, she pressed. My siblings racked up 5 knee ops in 4 years, bouncing surgeons because she shuns basics. She brands me heartless for advocating therapy over blades. Murmurs rippled. She's hooked on the drama, inflating twinges into crises, spawning issues from over-intervention. We must stand firm, deny even loved ones, for true ethics means restraint. A figure rose, Dr. Carla Voss, agency chair, the one helming Sophia's probe. She advanced stageward. Revelation incoming. Dr. Lang, Carla Voss, health oversight chair. A word? Sophia's poise cracked. Dr. Voss, certainly. You claim your sister's procedures were frivolous. Seen her charts? She shared details. Examined scans, op notes, labs? No need, 5 and 4 years screams excess. Or signals dire progression needing repeats. Without data, that's reckless judgment. Voss drew her tablet. With her consent, her history, Elena Lang. Advanced osteoarthritis, bilateral knees. Tried non-invasive for 10 months, therapy, injections, braces. All bombed. Op 1, right knee replacement. Issue, loosening. Op 2, revision. Complication, misalignment. Op 3, realignment with grafts. Setback, infection, 8 weeks antibiotics. Op 4, cleanup and redo. Op 5, full overhaul for structural breakdown. Silence gripped the hall. Sophia stiffened. Not addiction, but relentless pathology demanding escalations. All justified, no frills. As an expert, you ought to grasp that. I wasn't aware, you presumed theatrics, boss cut in. And shamed her here. Pause. Know your reviews Tuesday? Sophia's color drained. Private matter. Was, till you echoed your accusers, belittling agony, dodging tests, gaslighting the afflicted. Voss pivoted to the crowd. Dr. Lang faces 4 grievances, pattern of neglect post-op, leading to lasting injuries. The moderator stammered for privacy. No, Voss declared. She publicized bias by ridiculing a victim, her kin. To Sophia, 1 case, post-hip agony dismissed as frailty. Delay sparked dislocation, now partial paralysis. She thrust papers. Emergency review, Tuesday 8 a.m. proof fitness. You overstep. You invited it. Voss eyed me. Ms. Lang, apologies. Your file screams legitimacy, every cut vital. Head swiveled, parents' glee shattered. I rose, agony lancing my limbs, and exited. Tuesday's urgent session unfolded. I observed from afar. Voss tabled all evidence, including the talk. Sophia's license, revoked for 18 months, plus retraining and probation. Her institution yanked access pronto. Headlines exploded, ortho icon shames sis's ordeals, loses license. Parents rang furious, why no shield? From endangering lives? From faking my suffering? Error in judgment. Deliberate cruelty, years long. Dad, help or you're out. I've been out since you invalidated my hell, I snapped, disconnecting. My charts, shared willingly, illuminated facts. Voss noted, Ms. Lang endures real affliction, meriting empathy, not derision. 8 months on, Op 6 loomed. A fresh, empathetic surgeon nailed it, the fix stuck. Rehab brutalized, but strength returned. Pain lingers, yet I thrive as agency standards chief, nixing 15 like-minded docs. Sophia retrained but fled to a rural clinic, shadowed eternally. Kin severed, we don't converse. I crafted agency modules, my tail masked, this case, 5 ops in 4 years. Hasty eyes spot abuse, wise ones see necessity. 3 years post-symposium, my joints hold. Sophia's star dimmed, patience shun the mocker. No remorse here, she picked hubris over heart, scorning kin's torment. Oversight picked safeguarding the vulnerable. Some ops tempt overuse. Mine didn't. Docs blind to that distinction wield no blade.